What are the 5 stages of grief? You will all experience it at some point. We experience a significant loss. For some, it's a death in the family. It may be a job loss or other meaningful life change for others. For entrepreneurs, it may be the loss of a significant contract or closing one of their startups. Whatever it is that hurts you so deeply that you have no idea how to deal with it, it's perfectly normal. You are human, and you will experience grief. Here is what you need to know about the 5 stages of grief and how to manage them in the long term. Where did the idea of stages in grief come from? In the late 1960s, Dr. Elizabeth Kubler-Ross developed a detailed 5-stage model to describe and classify the experience of dealing with loss. These 5 stages were recognized by people coping with loss. They are anger, denial, bargaining, depression, and acceptance. This theory of grief became known as the Kubler-Ross model. The stages of grief were initially designed for sick people but have been adapted for other experiences with loss. The 5 stages of grief are perhaps the most prevalent. It's well known, but it's far from the only famous stages of grief theory. There are many others as well. Some, like the 2-stage model, only have 2 stages. The one with 7 stages takes a long time to train and may not be as accurate. The one with just 2 stages only has 2, but the first is where most of the features we're interested in happening. Is grief always following the same order of stages? The 5 stages of grief include denial, anger, bargaining, depression, and acceptance. While the 5 stages of grief are universal, there is no right way to feel during each stage. Feelings are subjective and may vary from person to person. Some people may not go through the stages at all. Many business owners think they have to make decisions every day, but what if they didn't have to? What if they could make decisions only once and then spend the next few years just managing them? Stage 1, Denial. Grief is an overwhelming emotion. It can take a while to recognize how significant the loss is. It can help to pretend that the loss hasn't occurred. This process gives you time to absorb the news and gradually process it. This is a defense mechanism that helps numb you to the situation. Once you've accepted yourself, those feelings you've been denying will begin to emerge. As you'll discover in previous failures, there's a tremendous amount of sorrow you'll have to deal with. That is also part of the grief journey, but it can be challenging to deal with. Stage 2, Anger. Anger is often a sign of denial. Our mind uses this strategy to shut out uncomfortable thoughts and feelings. Sometimes we redirect our anger at other people, such as the person who died, your ex, or your old boss. We may also direct our anger at inanimate objects. While your rational mind may know that the person at fault is not to blame for your anger, your emotions at the moment are too intense to see that clearly. Other more negative emotions may mask your feelings of anger. For example, bitterness or resentment may be more prominent than rage or fury. For some, the anger that you feel after an argument is still there, although it may be less intense. For others, the anger may go away completely. In any case, you may find that you can see more clearly. You may also begin to think more clearly. Stage 3, Bargaining. Grief comes in many forms. Sometimes an instance comes without warning, in which everything around us is either unexpectedly and simultaneously taken away or destroyed completely. And other times, it comes in the form of a chronic condition that follows a family over many generations. Regardless of how intense the experience is, we choose what we make of it. And this choice defines who we become. The bargaining stage of grief may result in you creating a lot of if only and what if statements. Grieving can also be extremely painful, and you may feel like you have nowhere else to turn and that no one will understand or be able to help you. Bargaining is a way of dealing with the emotional response of pain. It lets you make the most of your situation and postpone negative feelings like sadness, confusion, or hurt. Stage 4, Depression. You can think of the stage of grief you're going through as active or passive. Active stages are usually characterized by a desire to eliminate what's causing the loss by changing or denying it. It can mean a lot of anger or bargaining. Acceptance, working through the loss, and dealing with it as best you can are some of the characteristics of the passive stages of grief. To fully cope with the loss, you may choose to separate yourself from other people. That doesn't mean that depression isn't complicated or well-defined. Depression can be difficult and messy, like the different stages of grief. It is essential to keep in mind that you are in a genuine stage of grief, but the key is not to make the mistake of allowing it to continue to linger. You can find suitable treatment options by talking to someone knowledgeable about grief. A therapist helps a person deal with a problem. It can be a divorce, the death of a loved one, and many other issues. The idea of a therapist is to be available as a resource for people. Stage 5, Acceptance. Acceptance is not a happy or uplifting part of grief, but it is necessary to heal after trauma or loss. It does not denote that you're over the grief or harm, but it does mean that you accept what has happened and what it means for you. You may feel much different in this stage. It's natural to think that a significant event in your life will dramatically impact your mood and your outlook on everything that happens in the future. It's true, it can have a profound effect on how you approach new situations, but it doesn't mean you can't still have a positive attitude or make a positive change. The 7 stages of grief. The 7 stages of grief were developed in the 1950s by psychiatrist Elizabeth Kubler-Ross, who believed they would help people understand a normal reaction to the death of someone close. While these stages remain a popular way of explaining complex emotions, the Kubler-Ross model has been criticized because it oversimplifies the nature of emotional reactions to loss and ignores cultural factors and personal background. Emotions such as anger, sadness, frustration, and pain can become a part of your relationship if left unresolved. These emotions can also cause resentment in the other person, leading to more hurt feelings and the feeling that you are right and wrong. 7 stages of grief. You feel like God, or a higher power can somehow be held responsible for what's going on in your life. They cannot. If that's what it takes to feel better, you should be honest about what you need to feel better. It's not the Lord's fault. Increased isolation and subsequent loneliness may cook you with depression. They are the ideal moments to consider your loss, which, in turn, will help you start a more productive turn along with your depression. Your anger, pain, and loneliness have nearly all faded away, and you're now in a more relaxed emotional state where you are going through the procedure of recovery and healing. It's okay to start putting things back together again. It's okay. Because we all know that no matter how hard we try to change our life, something will get in the way: acceptance and hope. How much time is too long to mourn? There's no average amount of time to grieve. It takes as long as it takes to grieve. Some people can spend years going through a grieving process. For others, the mourning is over in weeks or days. It just depends on you and how long it takes to get over your loss. The way you grieve the loss of a loved one mainly depends on the relationship and how important the person was to you. Someone you love deeply will likely last longer than someone who was only a casual acquaintance. With the aid of meditation, you'll be able to return to your daily life. When you begin to take care of your body, it becomes easier to practice meditation. You'll be able to feel happy and joy, because you'll be able to return to your daily life. Do you need professional help? In some cases, grief doesn't get better. When your loss is complex and hard to understand, you may not be able to accept it. You may feel sad, angry, and guilty about what happened, even if you didn't do anything wrong. If these feelings last for longer than 6 months, you're at risk for a condition called complicated grief. Depression, like many other mental illnesses, is complex and requires treatment on multiple levels, but there is no shortage of ways to treat it. The goal should be to identify what is causing depression and then find a way to reduce the cause of depression. Therapists are skilled counselors who can help you explore your thoughts, feelings, and reactions. They can also teach you coping skills and guide you to a healthy lifestyle. They can even help you address a serious illness like depression. When we find ourselves in emotionally painful situations, we sometimes turn to substances such as drugs and alcohol to temporarily block our feelings. You may think it is a risky move, as it could lead to severe problems if misused. Addiction is a disease that comes with its own set of issues, not the least of which is that it affects not just the user but also those around them. Addiction can have a massive impact on their lives, as well as their families. Other possible stages of grief. Dr. Elizabeth Kubler-Ross first conceptualized the 5 stages of grief in her book, On Death and Dying, 1969. In her book, she provides a framework for how we process the death of loved ones. As it turns out, many professionals use the 5 stages to help people through the grief process. Other psychologists, including Elizabeth Kubler-Ross, who originally developed the 5-stage grief model, have extended it and adapted it for use in various scenarios. This extension is usually known as the Kubler-Ross change curve. You feel the pain in your chest, a pain that can feel like a lump in your throat. The sadness can be hard to get out of your mind. It can feel like your entire life has been thrown into chaos, but at the same time, there's a sense of relief. Maybe you even feel joy. This is what grief feels like. It's not the same as mourning in the way that grief is usually portrayed in movies and TV shows, but it's the grief that comes from the realization that something important to you has changed, a loss that makes you feel sad, angry, and maybe even frustrated. Depression. Lack of energy and intense sadness. Experiment with the new situation to discover what it actually means in your life. A decision is something that you make, and the word is derived from Latin decidere, which means to choose. In this case, a determination is what you decide to do with the new reality of the situation. Once you've made your decision, you have to start the integration process. That means accepting the new fact and then reflecting on what you've learned so far. And you need to move forward as a renewed person. Common misconceptions about grieving. People grieve in many different ways and for many other reasons. It is not possible to be expected in such a diverse world. There is no norm concerning how we deal with grief. Some people may need to grieve for a few months, while others may only need a couple of weeks. There are some basic things we can do to make life less of a burden in either case. There are no right or wrong ways to cope with loss, but the following things can help you move forward healthily. 1. I am doing something that is wrong. While grief can affect everyone differently, some universal themes run through the whole process. For instance, people often feel guilty for not feeling sad, for not really caring about the deceased, or for not keeping their promises to the person they've lost. Grief is a natural human experience, but the idea of a checklist of grief-related actions can add to the anxiety of grieving. This is because of the notion that you must follow a prescribed set of tasks to grieve appropriately. While it is true that grief can take time to process and heal, the idea of going through a checklist of things to do in a prescribed fashion can be very frustrating and ultimately discouraging. It is a unique and multidimensional healing journey. 2. I think I should be feeling. Everyone feels these emotions differently. If you've ever felt these emotions yourself, then you probably know how they feel. For example, you may experience irritability first and then feel sad afterward. It may seem like you feel a different emotion each time you experience a stage. But in fact, these are all normal emotions. Denial can be more about feeling shocked and disbelief than a realistic expectation that something will make the loss disappear. While the phases of grief are an excellent tool for helping people come to terms with the death of someone they love, they're not the only emotions people feel. You may not even notice the sensations occurring at any given time. But that's absolutely fine. That is because you're human, and your body is perfectly normal in every way. Your healing is just as normal as it is yours. 3. This should go first. As we mentioned above, grief has stages. It's not a straight line. Some days you might feel unfortunate, and the very next day, you could wake up feeling hopeful. There are no rules. If you're depressed, you may find yourself thinking of yourself as not only a worthless failure but a loser, too. You can feel hopeless, useless, and worthless. First reactions are generally negative. It's common to feel a little bit angry, a little bit scared, and a little bit sad, all simultaneously. 4. I think it is taking too long. Grief is an individual experience. No one person experiences grief the same way. How long someone takes to process the loss will depend on so many factors, from how the death happened, how the bereaved responded in the immediate aftermath, how long they had known the deceased, and what support they had access to. While your process will move at its own pace, the best way to make sure you stay productive in your grief process is to give yourself a reasonable amount of time to get through the process. It's a difficult time, so give yourself time to get through it. If you notice that you are becoming more and more emotional during the day, it could be a good idea to reach out for help. Your emotions don't necessarily have to be inadequate to require assistance. Sometimes people feel angry, sad, worried, or fearful and don't always understand why. 5. I feel depressed. Going through the stages of grief, mainly the depression stage, isn't equivalent to clinical depression. There's a distinction between having clinical depression and grieving. That means that while some symptoms might be similar, there are still fundamental differences between both. In grief, the intensity of the emotions associated with the loss will diminish over time. This is true in both positive and negative emotions. Clinical depression can be a severe condition usually treated effectively with a combination of antidepressant medications and psychotherapy. You can also make lifestyle changes to help you cope with depression, such as socializing more with people, exercising, and spending more time outside. Many people don't realize the possibility of developing clinical depression after a loss, such as a family death or a divorce. If emotions increase in intensity and frequency, you may be experiencing symptoms of clinical depression. You can take steps to treat this on your own. Talk to a professional who can help you. In conclusion, the 5 stages of grief are denial, anger, bargaining, depression, and acceptance. It is important to remember that everyone experiences these stages in their way and at their own pace. There is no right or wrong way to deal with grief. If you are experiencing any of these emotions, it is crucial to reach out for help. Many resources are available to you, including counseling, support groups, and online forums. Don't be afraid to ask for help.